Evening, everyone. We'll get started in just a minute. Okay, well, it is 2 minutes past, so I think we'll go ahead and get started. Good evening. Hi, everyone. Thank you for joining us tonight. I'm Kanika Young. I'm the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center, and thank you for joining us for the 2021 Healthcare Advocacy Series, co-sponsored by the Tennessee Justice Center and the University of Tennessee at Knoxville College of Nursing. I'll be facilitating tonight's webinar. Tonight's session is 2021 Healthcare Landscape in Tennessee, and it's the second in our three-part series. Our first session was Advocacy 101, and you can stream that at a link that I will place in the chat if you're interested in checking that out. Our third session will be on January 23rd, and it's a media engagement workshop with Dr. Carol R. Myers. Details and Zoom registration links for this event are available at tnjustice.org, and we'll also post the link in the chat so you can register for that series, for that workshop. A few items to go over this evening before we begin. First, we are live tweeting tonight's event with hashtag TNHealth 2021. So if you are on the Twitter sphere, we would love to see you post about the event using this hashtag. So that's TN Health 2021. And I will put that hashtag in the chat as well. Second, we will be monitoring the chat and we'll capture questions and comments for the discussion at the end of this presentation. And then also we are recording this evening session and uploading to the Tennessee Justice Center's YouTube page, and we'll send that link out to everyone who registered after tonight's webinar. So, okay, let's go ahead and jump into tonight's topic, the Tennessee healthcare landscape in 2021. I would like to introduce tonight's presenter, Catherine Crawford from the University of Tennessee College of Nursing. Catherine is a critical care registered nurse, health policy advocate, clinical instructor, and doctoral candidate at the University of Tennessee, whose scholarly interests include healthcare and language access. An alum of both the University of Tennessee and the University of Florida, Catherine has spent most of her adult life in the Southeast and finds it an honor to serve her East Tennessee community through nursing. Catherine, I will now hand the presentation over to you.
All right, thank you so much, Kanika, and welcome everyone to tonight's session. I'm going to go ahead and turn off my camera so I'm not distracting during the presentation. Okay. So before I get started in my presentation, I want to kind of give a little bit of background on how I became interested in health advocacy and policy. So as a registered nurse in a Knoxville critical care unit, and as a doctoral student in the family nurse practitioner program at the University of Tennessee College of Nursing, I've had an incredibly diverse experience in both primary care and acute care settings across East Tennessee. Regardless of the setting, whether I'm in a rural mountain clinic or an urban hospital, Regardless of the patient's age, from newborn to end of life, all Tennesseans need health care. It's kind of the common thread. So I was in a graduate health policy class and realized one of the ways I could make the most impact on the health of my community and those I serve is through health policy advocacy. So that's really what brought me here. And if you're interested in learning more about health policy advocacy skills, I invite you to review last week's session where Kanika gave a great overview of the topic, and we'll go ahead and include the link in the chat. Okay, so let's go ahead and let me get this going here. Let's dive into the Tennessee healthcare landscape in 2021. I must insert a disclaimer here, as many of the topics I'll discuss tonight are rapidly evolving as we enter the 2021 legislative session. So let's start with some background on the current state of our health. When looking at national data and comparing Tennessee with all other states, Tennessee ranks 44th out of 50 states. So that means 43 states are healthier than Tennessee, which is pretty staggering. These rankings are from the United Health Foundation and are based on 5 key categories: social and economic factors, physical environment, clinical care, behaviors, and health outcomes. One of the leading indicators for a person's ability to obtain health care is whether or not that person has health insurance. Tennessee has a higher rate of residents who are uninsured than the national average, with 10.2% of Tennesseans without any health insurance. Okay, so what's causing Tennessee's poor health ranking? Tennessee has a significantly higher chronic health condition burden than the national average. Diabetes, hypertension or high blood pressure, and cardiovascular disease are 3 of the most prevalent chronic conditions in the US. As you can see in this chart, Tennessee is in blue while the national average is in orange. So 13% of Tennessee adults are living with diabetes, 9% have cardiovascular disease, and 39% have hypertension. All 3 of these diseases can lead to life-altering complications. And we can see that Tennessee has a much higher rate of these 3 diseases than the national averages. So we know that Tennessee has a heavy chronic disease burden, but what factors lead to this increase? Sure, genetics play a part, but health behaviors and social and economic factors are really at the root of these chronic health conditions and whether or not they develop in an individual. We know the excess disease burden in Tennessee has a major detrimental effect on the health of Tennesseans, but how does this translate to dollars? The excess burden of just the 3 diseases I mentioned, so diabetes, cardiovascular disease, and hypertension, cost Tennesseans $5.3 billion, and that was in 2015, in direct medical care, lost productivity among residents, and premature death. So let's dive into the 4 main drivers of health in Tennessee: social and economic environment, health behavior, clinical care, and physical environment. Of these 4 broad categories, social and economic environment can have the most impact on whether a Tennessean develops a chronic condition. Tennessee is trailing the nation in education and poverty level. 74% of Tennesseans have less than a bachelor's degree, and 16% of Tennesseans are living in poverty. As we work to improve our health, the education and economic environments of all Tennesseans must be priorities. So health behaviors are the next most important driver of health. In Tennessee, 22% of adults are smoking, and 82% of us are not meeting national exercise guidelines. Prioritizing public health and health behavior campaigns is of vital importance to see an improvement in Tennessee's health. The next driver, clinical care, looks at healthcare access. The numbers in these charts are a bit dated, and the uninsured rate in Tennessee has actually increased, which is the wrong direction. Many of our rural hospitals are facing closure. Over the past few years, financial struggles have left 21 counties in Tennessee without a full-service hospital. Some people in Tennessee are having to take an hour-long ambulance ride to get to a hospital. So we really need to be working on this. Rural hospitals are closing at an alarming rate, and of those that remain in business, many are on the brink of closure. The final driver we will look at is physical environment. Though Tennessee appears slightly better than the national average for housing, housing is still a major issue in Tennessee, with 16% of the population reporting challenges with housing. If we are concerned with whether or not our family will have a roof over our heads, our health can certainly take a back seat, leading to disastrous health consequences. Do keep in mind too that this data is pre-COVID pandemic. So all across Tennessee and the country, people are especially struggling with jobs, housing, and food insecurity during this time of pandemic. I've reported very quickly on some major health issues across Tennessee, and you may be wondering how we can affect the health of Tennessee on a large scale. One of the answers is through health policy advocacy work. Policy affects all Tennesseans and can have a tremendously positive effect on our overall health, or can create more challenges for Tennesseans to realize health. Let's look at some of the most pressing healthcare policy issues in Tennessee. According to the Tennessee Justice Center, 5 policy issues are at the forefront in Tennessee. So number 1, the Medicaid block grant proposal. Number 2, children being kicked off Tennessee's Medicaid program. Number 3, public charge and the effect it can have on some Tennesseans. Number 4, the lawsuit to strike down the Affordable Care Act. And number 5, Tennessee's failure to expand Medicaid. I'm going to go ahead and talk briefly about each one of these policy issues. So the Medicaid block grant proposal, this has really been in the news lately. So Tennessee was the first state to ask the federal government to convert our current Medicaid program, which is called TennCare, into a block grant. So just days before a new administration will take office, the Centers for Medicare and Medicaid Services officials there approved Tennessee's Medicaid block grant waiver. So Tennessee is the only state in the country to pursue and be approved for such a drastic change to our Medicaid program. The block grant proposal has been met with significant concerns. TennCare currently provides health insurance coverage to approximately 1.5 million low-income Tennesseans, many of which are pregnant women, children, and disabled adults. The block grant invites discrimination against patients with costly medical conditions. For instance, the state could deny access to the most effective drugs for serious and costly illnesses like cancer and hepatitis. Many federal Medicaid protections that prohibit discrimination based on diagnosis or medical conditions could be erased for Tennesseans. By eliminating federal managed care rules, the waiver could let the state pay managed care organizations rates that are too low to cover the actual patient care costs. The managed care organizations could operate provider networks that lack the full array of providers that Tennesseans need. This block grant creates incentives to cut TennCare and use the resulting savings for other parts of our state's budget. As I've demonstrated earlier in this presentation, we need every single dollar of our state budget assigned to healthcare to go to healthcare. We have a long way to go in making Tennessee a more healthy state for all of us to enjoy. The federal approval can still be rejected by the Tennessee General Assembly or by President-elect Biden during his term. Okay, so let's talk about some of the most important people who are currently protected by TennCare, and that's our children. The number of uninsured children in Tennessee continues to rise. The number of children without health insurance has risen in the past 2 years, in large part due to the state's dramatic reductions in public coverage of children. Since November of 2016, that's when the TennCare eligibility redetermination process started. children's enrollment in TennCare has dropped by over 100,000, and this figure may actually be low. Additionally, nearly 30,000 children have been disenrolled in Cover Kids. If children were losing TennCare coverage because of increased parental income, they would be more likely to transition to Cover Care or Cover Kids, which has a higher income threshold. However, the drop in Cover Kids enrollments shows this isn't the case. Tennessee saw a 20% increase in the number of uninsured children in 2017. Sadly, Tennessee has seen a greater loss of health coverage among children than almost any other state. The data overwhelmingly shows our children do better with health insurance. The benefits of health insurance begin prenatally and have a positive health effect into adulthood. Children of mothers who were included in a Medicaid eligibility expansion study were followed into adulthood, and the results showed that these adults had lower body mass index, BMI, and lower rates of obesity in adulthood. They also had fewer preventable hospitalizations, improved oral health, and lower likelihood of high blood pressure, heart disease, and diabetes. Those were three of the major chronic conditions I mentioned that Tennessee is burdened by. So Medicaid coverage in childhood benefits adolescents as well, with decreased mental health problems, reduced likelihood of eating disorders, reduced BMI, lower likelihood of risky sexual activity, and less smoking and alcohol use. A child's health directly affects their learning abilities. Children born in states that recently expanded Medicaid have better reading scores. Health insurance expansion results in increased rates of high school and college completion. The evidence simply shows our children do better with health insurance coverage. Okay, switching gears, the public charge. This is one of the issues that's at the forefront in Tennessee. So the public charge is a ground of inadmissibility that can greatly affect who is able to obtain a green card, visa, or admission into the United States. So when making a determination, an immigration officer must decide whether the applicant is likely to use certain public benefits like Medicaid in the future. So public charge is a nationwide issue, and we really need to take a hard look at it through an ethics lens. Okay, so the fourth policy issue is the push by some to strike down the Affordable Care Act. As we can see, there is strong public support for major provisions of the ACA. Strikes against the ACA are detrimental to the health of Tennesseans. Let's take a look at some of the most important ACA provisions. So 82% of Americans are in favor of the ability of young adults to stay on their parents' insurance plans until age 26. Another great part of the ACA is that it creates health insurance exchanges. So small businesses and people can shop for insurance and compare prices and benefits. It also provides financial help to low and moderate income Americans who don't get insurance through their jobs. So this can make insurance coverage so much more affordable for our low and moderate income Americans. 81% support the Medicare prescription drug donut hole. So people on Medicare will no longer have to pay for the full cost of their medications. And so it closes that gap there. It also eliminates out-of-pocket costs for many preventive services that we all need. It allows states to expand Medicaid to cover more low-income uninsured adults. 77% of folks in the United States support this. And this is a major issue that I'll be talking about on the next slide. It also prohibits insurance companies from denying coverage because of a person's medical history, and increases the Medicare payroll tax on earnings for upper income Americans. Okay, so the final health policy issue I'd like to talk about tonight is Tennessee's failure to expand Medicaid. So Tennessee has failed to expand Medicaid. According to Vanderbilt and Harvard health policy researchers, Medicaid expansion has a protective effect for residents of southern states. Medicaid expansion is linked with a decrease in self-reported health declines and a greater likelihood of maintaining baseline health. Southern states like Tennessee that have not expanded Medicaid could improve the overall health of low-income residents, especially in our rural areas, by expanding coverage. Currently, there is over $1.4 billion sitting in Washington, D.C., set aside for Tennessee to expand Medicaid. An additional 300,000 Tennesseans could qualify for coverage if we expanded Medicaid. Okay, we've covered a lot of ground and talked about some really big subjects in a very short amount of time. So what do we do now? Let's use those advocacy skills that Kanika discussed in last week's session. I'm going to go ahead and share that link again. So if you were not present for last week's session, you can go ahead and watch it at your convenience. And if you're ready to let your voice be heard, please join us at our final session, which is going to be on Saturday, January 23rd. This will be a media engagement workshop with Dr. Carol R. Myers, who is a media expert in Tennessee. She is also a professor at the University of Tennessee in the College of Nursing and runs the graduate health policy certificate there. Okay. I'd also like to call your attention, and I will try and share the link for it here as well. The Tennessee Healthcare Campaign has a great webinar coming up this weekend called Closing the Coverage Gap in Tennessee. So I will find the link for that and share it in the chat as well. Okay, let's see here. So that's the end of my part of the presentation. I'd like to go ahead and see if there's any questions or comments.
Thank you so much, Catherine. That was a really great presentation. We have one question in the chat, which is, what specifically can advocates do about the TennCare block grant waiver? I guess if you don't mind, Catherine, I can address that.
Yeah, that'd be great. Thank you.
So the Senate voted today to implement the block grant waiver, and our latest information is that the House is going to be taking up the issue at 9 a.m. tomorrow. The Tennessee Justice Center has an email tool and a call tool that I will put in the chat for people who want to use that to contact their legislators to let them know that they don't agree with the block grant and that they should not pass this. And even after the vote tomorrow, I think it would still be appropriate for advocates to reach out and let their legislators know that they are not in favor of this. And aside from that, contacting your legislators, there's really not much that can be done to stop it because it is up to the legislature to implement it. But we do want to stay engaged on this issue and monitor how the block grant is implemented. So I encourage you to follow the Tennessee Justice Center. If you haven't already subscribed to our emails, I can put the link to that as well, so that we can keep you updated on any opportunities, and also to make sure that we're hearing from the community about what issues they're seeing as this proposal is implemented. It really is a radical change to the Medicaid program. So anyone who is impacted, including enrollees or providers, we want to make sure that we're keeping in touch with them to find out how this is affecting them. So let me, it's hard for me to think and type at the same time, but I will put the link for the contact tool in the chat.
Oh, great. And Kanika, it looks like there's another question. Do we need to advocate with our federal legislators?
No, not on Tennessee's block grants. So Congress, our federal legislators in Congress really don't have any say over this issue. It's going to be an administrative issue. So once President-elect Biden appoints the head of the HHS and CMS, they would be the administrators who would be in charge of monitoring how the program is implemented, but Congress wouldn't necessarily have any say over it at that point. Once the legislation is done, it's out of their hands. So the Tennessee State Legislature right now is the decision maker, and then once they have approved it, the next level will be the Biden administration. So at the executive branch or administrative advocacy would be a way to influence how they decide whether to withdraw that approval that CMS gave during the Trump administration. If there are any other questions, feel free to put them in the chat. Oh, one other thing that I should mention is that if you want to learn more about the block grant waiver, Tennessee Justice Center is hosting a webinar on Tuesday at 1:30 p.m. Central Time, and you can attend that and get some more details and like the nitty gritty about the block grant. So I will find that registration link and put that in the chat as well. And if anybody has any other questions, feel free to add those.
Excellent. And I just added the Tennessee Healthcare Campaign, the Closing the Coverage Gap in Tennessee webinar that's going on this Saturday as well. I posted that link in the chat.
Great.
Any last questions or comments from anyone? Okay, well, thank you so much, everyone, for attending tonight. And I really hope you'll join us for Dr. Carol R. Meyer's Media Engagement Workshop, which will be held on Saturday, January 23rd. And that's a 2.5-hour workshop. And it's gonna be great and very informative. So let's let our voices be heard. All right, I hope everyone has a great night. Thank you.
Thanks, everybody. Bye.